we will start off with the
Thank you.
mental health, and Rob, so if you can get us started, Rob, we would deeply appreciate it. One of the things we certainly hear in the news today is in an editorial in the Post-Star on Saturday. It's hoping for mental health improvements with the reduction in mental health activity as it relates to Glens Falls Hospital. I think everyone in the community sincerely hopes that the void is going to be reached. And do we have a quorum? We do. Thank you. Yes. Yes.
If I may, would you still have a quorum if I asked to be excused?
What do you think?
Yes.
Yes. Thank you.
If I may.
Thank you, Supervisor Leggett. Okay, appreciate you doing that.
Let me go over there to balance this out.
Rob?
Okay, yes, I will provide a little bit of an update on our process with Glens Falls Hospital, but first on our agenda, we
Chasing
have
this cat.
2020 proposed budget, and Harry Carlson, our Deputy Director of Fiscal, is with me today. Harry developed the budget, and Harry is going to walk us through the budget.
On the revenue side, there were just a couple of changes. The engagement fund, we just put it at 10,000. We never really know what we're going to get. Change the average for quarters. 2019, we got about 7 quarters. We're hoping it's been even out for 4 quarters in a year. The Center for Return to the Alcohol and Prevention Program. Not speaking up? Okay, we moved the money out of the federal dollars or revenue coming in, because for OASIS, they're going to be all under state funding now, rather than federal funding. So we just moved that down there a little bit. And also, that's about it for the revenues side of things. Now Parsons did decrease from about $1.4 million down to $1 million, just about $1 million. And that was just due to the fact that prior years there was $300,000 approximately in startup monies that will go away this year for 2020. They should be totally self-supportive now as far as that program, the ACT program.
That's by design. The ACT program is front-loaded to get it started with state aid, but then it's supposed to rely more on billing as it develops.
As far as the expenditure side, in our budget itself, we just moved some monies around in working with the Treasurer's Office, moving things up in different lines and reducing some things, some products. And the property stayed at a 2% increase. And of course, the salaries and the fringe benefit packages, it is what they tell us it is. There's just, we've tried to estimate it, but the numbers that appear here are the ones that came from the Treasurer's Office. And as far as the contracts, there's very little change with the exception of the Parsons, where it was reduced by that startup money, but otherwise it stays pretty much the same. Usually we don't hear if there's any increases until it's after the budget has been finalized at the county level. And of course, then we just modify the contracts and the budget for when we finally get that those numbers in for 2020. We anticipate a certain amount of COLAs and that type of thing, but we have yet to receive that information. Like I said, we usually get it in December. Then as far as you can follow it also on the contracts, where we just compare the different contracts for the different years, increases. In the county increase, that is basically when, in our budget, when we did this numbers, we added 2% to the salaries, which of course is not reflected yet, or may not be reflected in the actual county budget. But that's mainly the increase of the $6,000. It's basically decided at 2%, and the best we could do to estimate what the fringes were going to be. Of course, FICA is pretty easy, but everything else is pretty much, we just estimated our best guess in that, our best. So that's pretty much basically it. I mean,
Good. Thank you, Harry. I appreciate that. Any questions for Harry or Rob? Go ahead.
Thank you, Mr. Chairman. Of all the budgets I've looked at, this one, from 2019 to 2020, is almost to the penny. A lot of the numbers are exactly the same. And you had the one,
So this is
revenues are going down. No change in revenues, no change in expenses. And I call back in 2012 timeframe, there was no budget crunch. State and federal governments were decreasing their funding precipitously. So there were a lot of changes that you folks had to do in order to maintain service, and a lot of times you weren't able to maintain service. Where do we stand as far as your ability to maintain service and the target that you would actually like to achieve as far as service level? Where do we stand with that now?
I mean, I think we would be maintaining services that are available in the community currently. If there are any COLAs or some additional funds, as Harry mentioned, sometimes we find out about that as it gets closer to the beginning of the year or even after the first of the year. And then we would have to amend contracts or budgets. But, otherwise I don't foresee any cuts here, if that's what you're meaning, or...
No, what I mean is, we had X level of service in 2007, and it dropped in 2012, that plus or minus. But considering what Chairman McDivitt mentioned in the beginning, the importance of the increasing feeling in the community, the importance of mental health, and considering the cuts that we had to suffer 8 years ago, are we at the level that's ideal for the community, or are there still things that you would like to see expanded?
Well, I would say since the time frame you're referencing, we have expanded services quite a bit. We're doing more school-based services for children. We brought in mobile crisis teams for both adults and children. We've developed the ACT team, the Assertive Community Treatment Team, so there's 48 additional slots for adults with serious mental illness. So there's a number of areas where we feel like we have been able to increase services for the community. And I would say in relationship to the outpatient services and what we're going through with the hospital, we're also trying to expand those outpatient services by bringing in another provider. And actually it's an existing provider, Parsons. Northern Rivers are really the same organization, so we already hold close to $1 million contract with them for various other services they're providing in our community. So they're now going to also operate an additional clinic. So again, we to the degree we can, we try to increase services, and I think we've been able to do that over the last several years.
Thank you.
Supervisor Driscoll.
Thank you, Mr. Chairman. Rob, some of your contracts and budgets are multi-year programs, so you're essentially plugging the same numbers in for 2 or 3 type of years. Is that correct? Okay. So that would account for some of the consistency. Thanks.
Thank you. Any further questions for Harry or our director? Seeing none, let me just back up a couple of tweaks of the clock here, and can I get a motion to approve the minutes of our last meeting? Supervisor Loeb, seconded by Supervisor Bramer. All those in favor, aye.
Aye.
And Edna is on vacation. He's on a cruise, hopefully floating down the Mississippi, and with a glass of Chablis in one hand, and we wish her the best, and hopefully she'll be back soon. So, that being said, thank you, Rob, thank you, Harry, okay? Appreciate your efforts,
Thank you very
okay?
much.
Chris, you're up.
Lots of Shapley in our committee minutes, in the other hand.
I could just say
Do we need a motion on the budget?
No.
Did you do your program update?
I could just say a few more words
Oh,
about the hospital.
go ahead, please.
Yeah. So, I guess this is my first opportunity
Thank you, Chris.
with the committee to talk about the announcement by the hospital of discontinuing the outpatient mental health services and substance abuse services. The hospital approached me earlier in the year, before any announcement was made, sort of in an exploratory fashion of, this is something we're having to look at and looking to work with you around, possibilities of discontinuing the service. So that's when we started a process together with the hospital of reaching out to some providers to see would there be potential providers in the area capable of taking over their outpatient mental health and substance abuse services. So once we were able to reach out to some agencies and determine that there were agencies that were similar sized, providing similar services successfully in the black, then the hospital sort of moved toward their decision that they probably would be discontinuing these services. So they didn't want to come out with an announcement prior to that because of the effect on the workforce. You didn't want to employees to be worried or scared of what's happening. So there was some planning that was done ahead of time before that. So we're still in the process with the hospital. They've been, to me, in my experience, very good partners through this process. They're not just turning it over and saying, hey, we're done, we're getting out. They're working with us to bring in the providers, have them meet with their staff, exchanging financials, looking at various factors, salaries, benefits, etc. And so we're working to try to really find the best fit for another provider to come in. It could be multiple providers, it could be a single provider, come in and really just kind of assume or take over their services, staff, the patients, maybe even leased space, etc. So that's where we are at the moment. We do have several providers that we're still talking to, and we think that they seem to be providers in good standing, with the state, and like I said, currently successfully providing similar size services.
Thank you very much, Rob. I think the message going forward, I believe, and I think it's a very accurate message, is that Warren County government and your agency under your direction clearly appreciate the need and the importance of appropriate mental health services in Warren County. So I think we are stepping up to the challenge, and we will, I think, move forward in a very positive vein. So again, we thank you for your leadership, Rob, and in grabbing the football from the hospital and moving on with to ensure that the services continue to be provided in Warren County. So thank you. Thank you very much, Harry and Rob. Appreciate it. Okay. Chris, it's your turn. First of all, I want to congratulate you on your promotion, elevation. It certainly is our loss, and we can well appreciate why you are moving up a couple of rungs in the equation here.
Yeah, thank you.
So congratulations.
I appreciate it. I thought it would be a good idea to have Annie McMahon, our account manager, here with me this morning, since she's never been to a committee meeting.
Well, welcome.
She does all the bookkeeping and time records department. So when we go from a staff of 6 to 56 every summer, it falls on Annie to take care of the paperwork.
Thank you.
I just had 2 items. Thank you for your kind words. I just had 2 items this morning. Oh, I'm sorry. Yeah. No, I got 2. Thank you. The first one is to amend our department budget for the MOU with social services that was adopted last month. And on the last page, I did highlight the meeting minutes, context in reference to the item. One of the things that I mentioned to the county administrator is I had really hoped that we would have this finished before I left, and obviously it won't be, but I think we'll have enough of it in place that it'll be ready to kick off in January as planned. In my mind, it's one of the most exciting things that we've done during my tenure, is that new agreement with social services to work with joint customers.
Very good. Can I get a motion to, for this request? Supervisor McGowan, seconded by Supervisor Loeb. Any further discussion? Supervisor Bramer.
This is for the 2020 budget,
Yeah, it starts in January.
so it's not, there's no, is there revenue coming from, oh, it's coming from Social Security.
It's coming from social services. Yeah, we will contract with social services.
And then, do they have any revenue covering this?
We do, a lot of the expense will be put as a safety net. We can't apply towards the grant. We will get
Great. Thank
Yeah, we
you.
met with the county treasurer, with Rob, to talk about the codes and how this should be set up, and this was the way he recommended.
Right, thank you. We have a motion on the floor. All those in favor?
Aye.
Opposed? Number 2.
That was just to fill my vacancy coming up. It has been posted.
Okay, great. Motion is put on the floor by Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed?
I just want to add, it's really been a pleasure to serve the county. When I send out my calendar every month to the board, I do say, I appreciate the opportunity to work with the board and the county residents, and I really mean it. It's really, I just want to thank everybody for the experience.
So what's your schedule?
I have 2 weeks left in the office, so get in touch with me. Short window.
Thank you for your service.
Well
I want to just thank you, Chris, for all you've done for the county, and appreciate it, and I'm really happy for this opportunity for you, so.
Very good. Again, we thank you one more time. So, wish you the best, okay? Yeah. Bye-bye. Thank you.
Back again? Okay.
D, Office of Aging.
Good morning, Dee.
That's quite it.
What do we got, 2?
Appreciate it, yeah.
Oh, that's yours.
Do you have any more? Sure. Was that a short one?
2.
One more. They're right there. Oh.
Oh.
Ben. Thank you.
Do you want that?
I want to take this away from you, children.
Mine was accidental.
Mine too.
Now they won't be able to hear us.
How you doing?
D,
Good morning.
we would,
So the first item on our agenda is permission to transfer money from our district supplies to our district part-time salary to cover that temporary aging service position that we approved at the last meeting as board.
motion on the floor by Supervisor McGowan, seconded by Supervisor Bramer. Can we have some discussion? Supervisor Bramer. You're...
No, I'm just scratching my head. I can't, that's fine.
I thought you'd have a question, but no?
Yeah. So did I.
Do you want me to ask something? Seems
No,
like I asked
no.
for all the
No,
committee
we don't.
members.
actually.
No, don't ask.
Any discussion on the motion? All those in favor?
Aye.
Aye. Go ahead.
So the next item is our 2020 budget. Pretty much everything is staying consistent. The last stapled together section has our breakdown of the funding that we get from NYSOFA. And these are all tentative allocations, because we don't get the actual allocations until well into the year. It gives you an idea of how much we use, and then what's covered under each different program.
Any discussion? All right, go ahead.
Mr.
Supervisor
Chairman,
Love.
question on the budget, that services being maintained, achieving the goals that you want to achieve?
Yes.
Thank you.
Great. Yeah, Supervisor Conover, I'm sorry.
He maybe just quickly explain the difference between the 2018 expenditures and the 220 requests, and also the revenue 437, 2019.
That's because of the difference of moving it from various different budget codes into just two, one for Hamilton and one for Warren County. All right. Is that enough explanation?
It's perfect explanation.
Okay, thank you. Supervisor Love.
Just in understanding the process, Hamilton County, do they have actual office facilities and personnel in Hamilton, or is everything out of?
It's out of our staff.
Just the budget? Same people working on it, but there's two different budgets?
Yes.
Thank you.
Okay. Senior picnic.
So we had our senior picnic on September 11th. We had well over 200 seniors in attendance. And we just wanted to give thanks to everybody that helped us out with it. The fish hatchery, that's where we had the picnic. The Lake Luzerne meal site provided the coleslaw. The Bolton meal site did the macaroni salad. Like Adult Home was gracious enough to let us use their grill, strawberry shortcake, as well as various other things. And then, most importantly, the Warren County DPW for helping them set it up and take everything down.
It was a nice day.
Yes.
Very good.
There.
Supervisor, yes.
I was just curious, going back to the HEAP, do you have a relationship with Hamilton County Social Services for HEAP applications also?
Yes, we have a memorandum of understanding with them where we get reimbursed $10 per application.
Okay.
We don't typically do that many. They do
Right.
a lot of their own.
Okay,
Yes.
so it's not a big revenue source?
No.
Okay.
No.
Good, thanks.
Good, thank you. Okay, go ahead.
I wanted to let you know that I heard some very positive news out of the Queensberry meal site, and I wanted to have, ask you what your perception of how things are going there.
We continue to have some minor issues there, but overall, things are going well.
Good, thank you very much. Okay, good, I think we're done, Dee. We thank you so much for your help and appreciate it.
This is real helpful, too. These are great.
Denise
All
with
the
Veteran
acronyms,
Services,
all
please,
the,
yes.
The numbers and stuff, yeah.
Thank you, Denise.
Fingers usually.
You had an event last week, I think, Denise, didn't you, in Bolton, for
Yes.
Vietnam veterans? Being a guy that gets up very early, I read that email regarding the event in Bolton. I know where one thing is in Bolton. I know where the new beautiful visitor center is in Bolton. Was it Edgecombe Road? That's where the event actually occurred. So I understand it was a great event and well attended, Denise. So it.
So that actually wasn't it wasn't my event per se.
Uh-huh.
the Bolton American Legion is the one that developed that. But I was definitely part of helping push the word out and, you know, being present and everything.
Wonderful. Well, we thank you for
Yes,
that, okay?
yes.
And
Liaison.
it's well appreciated.
Yes, the liaison. Did I miss anybody on meeting and agenda? No? Okay. Oh, glasses.
Very good. Well, one, looking for a budget approval for the Veterans Services peer-to-peer. Maybe
Veteran services and peer-to-peer? Yep.
Yes, maybe.
Yep. I don't know, it's...
We get a motion to get it on the floor. Thank you, Supervisor Driscoll, and seconded by Supervisor McGowan.
Is that for everything? Both budgets, or what are we...
We're just the budget approval for
Oh,
specifically
okay.
for the Veteran Services peer-to-peer.
Kinda
Is there any,
Towards the back?
what does the program do, Denise? Yep.
So, it's the Joseph P. Dwyer grant, and we've currently received $185,000. It was designed to peer veterans with veterans, and also an emphasis on homelessness and at-risk of suicide veterans. Again, the program's up and running. Vanessa is diligently going to every training possible to just network with community members in the mental health field. And she's having her first meet and greet at Spot Coffee this morning, so hopefully she has a good turnout for that.
Great. These are difficult issues in our time, and so I think everyone appreciates any effort one can do. We have returning vets coming home that exhibit some issues in their lives, and the suicide rate is high. Okay, so your efforts are sincerely appreciated.
Thank you.
Supervisor Bramer.
Thanks. I completely agree, but I have a question about the
Sure, please do.
contract line. What is the 61.5 under the contract line? What does that entail?
That entails the billboard that we just increased, right? I think by, I want to say it was 15.9, so minus that out, and then we had things that we were going to roll out, like a website development. Again, not knowing how, I really have never been able to do this kind of stuff, so I didn't know really how much to put in that budget line, so we just drew down enough, probably over, I extra cushioned it, because I didn't really know what we were going to need. Maybe some branding cost in there, just the initial setup stuff of getting this program up and running and visible, right, within the community.
Yes, which I think you're doing a good job with on social media. Is Vanessa part-time?
She is.
Is Washington County passing like a duplicate budget or a parallel budget to us? Or
No, because we hold all the money.
we're holding all the money?
Yes,
we're
for
spending all the
both
money.
counties.
Okay,
Yep,
okay.
yep.
So she is just, I was thinking maybe she's only getting a chunk from us and then a chunk from Warren
No,
County.
no,
Okay.
we hold all the money for both counties. We do the payroll's done here, everything's paid out of here.
Okay.
Great, thank you. I've just been advised that we do not need a motion to approve the peer-to-peer services, so we'll redact it.
I will-
If we can back it up in terms of the sequence of how we originally did that, would appreciate it, and let the minutes please reflect that. But a request for a new contract, we are apparently going to need a
Yes.
motion for
And
that.
that is for veteran services, not peer-to-peer,
Okay.
okay?
Yep.
Currently, we have a program that we use, an electronic program, it's called VIMS, Veterans Information Management System. And I don't remember exactly what year we purchased that contract. It was within the last, let's say, 5 to 6 years. Unfortunately, they've had some structural changes within their company that they're not able to keep up with the changes that the VA is rolling out, like electronic submission timeliness of rolling out the VA forms as they change. So we went out and started looking at other companies that would be able to support our needs. VetPro happens to be piloting currently right now with the VA to do what they call D2D. It's an electronic submission process. VetPro also allows for multi-user, web-based access where our current program doesn't. It's held on our server, so we don't have as many tools available to us that we could have with a bigger company that offers those kind of resources. So we're hoping to make the transition prior to when our current contract runs out so that we can first learn, make sure we understand the program and how it's going to run and that kind of thing. And we have to do the data merge conversion. So we want to make sure that everything's up and running before the old one goes away. That's why we're asking for it currently now.
Supervisor Bramer.
Is this to submit information to state VA or federal?
There is no state VA.
There's no state VA?
No,
Okay,
just
so
federal VA.
And they're not providing any guidance as to providers of this kind of service?
No, that would be a conflict of interest.
They can't give us-
recommend anybody.
There's not like a list of approved contractors kind of
There's
thing?
only 5 in the whole nation. So, and some do more than others. There's only 5 electronic data management systems in the whole nation
For veterans?
for veterans data. And we're currently using one of them that's not web-based.
That's just seems
Supervisor Loeb. No, go ahead.
unbelievable.
It does seem unbelievable, but they've never allowed, prior Supervisor Bramer, they've never allowed other entities, outside entities, to talk with them electronically. It was all this, very secured paper, everything was on paper, handwritten. Now they're like, look, we need to roll out things a lot faster, so we need to start partnering with companies to allow for electronic data transfer. So this is all very new to the VA too. Their security systems and everything else internally. So very few people are, and I say people, I mean companies, are allowed to do this kind of interface, electronic interface with the VA, like Social Security.
Okay.
I know. It does seem a little,
It just seems kind of risky that we're going with VetPro, who you said is just rolling it out. But
Yep. There's another one it's called Vetrospect, and it's out of like Michigan or something, but we don't own our own information. They basically, once we, if we were to contract with them, they're holding our information on their servers, and I didn't want that.
Yeah.
So, I'm not like this tech-savvy person, but Cindy has a better background in it, and she's, laid it out for me, and it just makes more sense for us to still own our own information, but be able to have all that easy access to submitting a claim. I mean, there's only 2 of us, and we're moving as fast as we can, so if this program's going to allow us to move just that much faster, I'm all for it.
yeah. Have you been able to talk to our county IT guys about this?
Yes,
And-
yes.
okay.
Yep. Actually, VetPro was one of the ones that was introduced before, but we were so green at it, we didn't know what we were picking. And not that our current system wasn't working for us. However, things have changed over the last 5 to 6 years whenever we purchased the first one, VIMS, and we just need to move faster than they can go right now, even.
Thank you, Denise. Supervisor Loeb, did you have something?
Yes, thank you, Mr. Chairman. Just to expand on what Supervisor Bramer asked, so there is some sort of interface between this program and the county system, and are you getting some support from Mike Coleman's office?
Oh, yes, but there would be no interface any longer. So right now, our data, veterans data, is being held on our server, and eventually, they're either going to tell me, look, you got to go through and weed some stuff out. I don't know, but there's not enough in there right now to warrant that. But eventually, they would say, look, Veterans Services, you need to go in and start cleaning out your data. You're holding way too much data on our servers. With this new system, the data still belongs to us, but it's going to be a web-based program, so the data will no longer be stored on our server. There are certain aspects of the current system that we did not uphold, like scanning electronically all discharges into the system, because they're being held on our server. And the process was cumbersome, so we chose not to do that. We chose to keep those in hard copy, where with the new system, it'll all be in the cloud, right? So we would have that, it would be better accessible to do that with a secured net, because the county will always secure our network. Does that, and again, if something I'm saying does not sound, you can always call Cindy, because Cindy has a much better grasp on the concept of how this all works.
Thank you,
Okay.
Denise. Appreciate that.
Mhm.
Can I get a motion to approve the contract? Supervisor McGowan, second by Supervisor Loeb. Any further discussion? All those in favor?
Aye.
Very fine. Thank you very much, Denise. I
Okay.
appreciate your efforts.
Thank
Okay.
you.
Thanks.
Veterans budget, she went through peer-to-peer, does she need to do veterans budget as well? There's two budgets, one
Okay.
Yeah, we
peer-to-peer and
didn't
one
go over the
veteran.
regular budget.
If she would like to, she can. So if you-
Yep. So Veteran Services is the whole peer-to-peer, falls in as like a subdivision of Veteran Services, but you will notice, I do believe it was 4 pages. The breakout is separate. So I've submitted the Veteran Services budget in the first 5 pages, and then the peer-to-peer budget in the next 4 pages. And revenues, as of this year actually, we used to get a state aid grant from New York State Division of Veterans Affairs of $8,529. They've now allotted $10,000. So that is a change, but that change actually happened this year. I'm not 100% sure whether or not, off the top of my head, whether or not that's already been awarded, but it would be coming, if it didn't already come this month, it would be coming next month. And going forward, right now, $10,000 is allotted. New York State is also offering other things that I won't have to purchase in my new budget, which would be an electronic version of the Code of Federal Regulations. It's approximately a $300 expense. 2 big Bibles of veterans law, rules, and regulations that now New York State's going to roll out to us free of charge. And that's a wonderful thing. And also training. They are also, they have budgeted out in their budget to offer free training to the Veteran Services Department across the state. So there'll be some, again, it's budgeted in here for the new year because it's new and we weren't sure how it was going to roll out. But come the next budget, we might be able to tweak some things knowing what the state is actually going to offer and not offer. I don't believe under Veteran Services there's a terrible change to anything except for, again, asking for this new contract. So in there for the new year, $2,000 will be budgeted out for the maintenance and multi-user compared to $750 what it was previously under the VIMS contract.
Any questions? Yes, ma'am.
You have a transfer of funds in your packet, but I don't see it listed on your agenda. Do you need this?
Oh, so not on the new agenda? You didn't get the request for resolution number 4?
Right, it's just not listed as an agenda item, so it hasn't been done, but do you need to move the $49.95 to pay for your contract?
Yes, ma'am.
You need a motion for that.
Right. Can I get a motion to that effect? Ms. Bramer, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
I have a question.
Supervisor Bramer.
What does the State Division of Veterans Services do?
Same as I, just a different entity.
But all the other stuff is managed by the federal government, like
So, we're not the
federal
VA.
veterans. Right, I get that part.
Mm-hmm. And the state is not the VA. The Division of Veteran Services, they just changed their name. But they're also not the VA. They're an advocacy division, on a state level, and then we have 62 counties that have county service officers, which are also advocates on a county level.
So is your budget completely funded by the state?
No, only 10,000.
I'm
Yep,
teasing, but seems a little odd, seems a little duplicative.
yep.
I don't,
Well, no, it's not so much, there's not enough service officers in the whole state to include state advocates and county advocates. We could use a whole hell of a lot more. There's not enough. For the number of veterans within the whole state, it's just a small portion of advocates.
Good. Any further discussion? Great. Seeing none, we thank you, Denise, for your efforts. And
Yes, thank you.
okay,
Thank you.
Chris Hanchett, you're up, kid.
what is the state doing then?
Questions?
What are they doing?
In Warren County, did anyone in Warren?
We're doing all the work.
Call the state, or you guys take care of that?
So you can move around.
Right, and then they give us $10,000?
I mean, let's say you came in and you didn't like me for whatever reason. You didn't like that I was a man.
Thank you.
Or you didn't like, which has happened. You don't like that, just the way I do business. You could, call up the state rep right over at the college and use him instead. So veterans do move around. They jump around.
And of course, the one in the
It's
college.
the nature.
If a veteran from Clemens Falls that you have a relationship moves to South Clemens Falls,
Did you get
can
this?
you still?
Oh, absolutely.
Yeah, so, I mean, if
Absolutely.
they're comfortable working with you,
Yep. So, I mean, we each have our own clients.
Yeah.
and so there's approximately 7,000 veterans in Warren County and approximately 7,000 in Washington County. Let's just take
Yeah.
one for instance. If you're a Washington County vet coming to me for the first time, I'm going to first ask that you already reach out to the counselor in Washington County.
Right.
Because if they're all coming over here,
Sure, yeah.
I'm barely doing what right? So if they then explain, look, I've already done that, I would like to have you look at something with that, obviously, yes. I have no line boundaries.
I'm disappointed I didn't win anything from the raffle this
I
year.
know.
Yeah, me too.
Sorry about that.
Next year.
I gotta put in more money next year. Thank you for being there all day.
Thank you, yes. Thanks for showing up, and I heard you had a good conversation with Leather Stocking.
Yeah, yeah.
Chris, you're up. Personnel request.
Wait, I only have country, but never mind. Focus.
Morning, everybody.
Good morning.
The first item I have is a personnel request. I intend to fill a vacant position of caseworker number 34 in Child Protective Services. This is a grade 16, step 3 position. The base salary is $43,390. This is due to a resignation effective October 5th, 2019. Position is mandated and reimbursed.
Supervisor McGowan, seconded by Supervisor Loeb. Any further discussion? Supervisor Bramer.
I know you love this. Do these caseworkers, do they have a master's? Do they have masters in social work?
They are required to have a bachelor's
Bachelor's.
degree.
Okay.
Some do have master's degrees, though.
But they're not required to. Okay,
No.
just curious.
No. Any further questions? All those in favor?
Aye.
Number 2.
All right, the second request I have is basically a correction. It's a request to rescind resolution number 264 of this year. This was a duplicate request authorizing the continuation of the agreement with the Council for Prevention of Alcohol and Substance Abuse. The total amount of $67,295 was incorrect. There was we were waiting for a confirmation of funding levels from the state. So the correct continuation agreement, we did bring to committee for $69,000, and this was approved by the July board meeting. That was Resolution 386 of 2019. So it's just to rescind that number 264.
Supervisor Bramer.
Yes, I'll move it.
Seconded by Supervisor Loeb. Any discussion? Supervisor McGowan, no, or?
Oh, no, I was,
No? Okay,
that's a
you're
second.
just waving, yeah.
That's a
Okay.
first and that's a second.
No. No problem. Any further discussion? All those in favor?
Aye.
Aye. Number 3.
Number 3 is our budget for 2020. That would be the big, thick, heavy handout that Julie's going to speak about a little bit here. That's just a summary of our budget, and attachment number 4, of course, is our monthly revenue and expenditures, which Julie will speak to as well.
Julie?
For the 2020 budget, I did there's a cover sheet that is all of our budgets at a glance, where you can see 2019 and what I'm projecting for 2020. The total county share increase is just a little under 2%. We're seeing a little less state and federal revenue, which increases the county share. That's because a lot of our allocations have been decreased going into 2020. Fortunately, we're seeing a lot smaller grants. Statewide, what's happening is they're identifying a need, and they've been giving us smaller grants for targeted things like our SNAP program. We got a $50,000 grant. We bought scanners and shredders and a lot of equipment that really was needed. So we're hoping those continue to make up for the lack of the allocations where they've been cut, because they really want to target specific. However, I can't budget for those because they're not promised. But all in all, I think we did okay. We're counting on our Medicaid weekly share going down a little bit, which is always helpful because that's 100% county share. So that going down is going to be a tremendous help.
Sorry, Chairman, can you explain those last two things? Why is our allocation going down and why is our Medicaid?
In our grants, like
Yeah,
we
why
get a
does that
foster care block grant, and that's we get our Title 20, which is for our adult protective, our domestic violence, and they've all been reduced because of budget cuts.
These are federal dollars.
Federal and state.
Okay. And then why is our Medicare share going down weekly?
Medicaid.
Sorry,
Medicaid, because they got capped. 5 years ago, they started with a cap where they were allowed only to increase so much for each year until it leveled off. And so this is the first year that we're
Leveling.
It actually is going to be a little bit less because technically we were counting on it leveling off last year, but the state charges on that. We're hoping that before year end we are going to see a refund because it should have leveled off last year.
That's coming from the state budget process.
Yes.
Good. Thank you very much, Julie. A resolution is not necessary, so we can move forward. Any further discussion on our budget? Supervisor Loeb.
The Medicaid is dropping $200,000, but I'm looking at some of these programs, projected county share, dropping in small chunks. But I look at the safety net, doubled, 400 to 800,000.
Safety net is very, very difficult and it's very little reimbursement. What in the budget process, what I do is a 5-year look back, and I run a 5-year report on safety net. And the numbers, while they have been consistent, the expense portion of it has been extremely much higher. I think in part a lot of it is our hotel costs have really skyrocketed. We're seeing a lot more families, and we're seeing them staying longer in a hotel. We're hoping with contracting with our Open Door that will help lower some of the costs. It will be year one with Open Door, so I'm not really sure where that's going to come in at, but we are hoping to at least level it off in our safety net. The contract with employment and training, that's one of the goals, is to really get those safety net people coming in that fall under the safety net, to get them working, get them trained, get them working, because that's where we're going to really see where employment and training is their end of the contract. That's our goal, is to get those numbers up.
You described that we have a trend, you've seen a trend going on with increased need, but this is such a big jump. What are you seeing that's going to cause us to have a 100% increase in county share? I mean, it's not just 100%, but I mean, it's close to a $400,000 increase.
Well, what happened for this year is I way under budgeted based, again, on same numbers. You know, you're thinking if you had the same number of cases every year, that the cost is only going to go up an average of, 2%. Well, what happened for 2019 is I had budgeted a little over $1 million, and we've already spent 1.3, and it's only September. So really what this reflects is the increase in 2019 and an increase for 2020, because it's not an area you really want to under budget, because so much of it is its county share.
All right, I should have seen
Do you have a question, Supervisor Bramer?
I do. I'm glad to hear that you're contracting with Open Door. Because that was something that I looked at when you first came on board, but even before that with the prior commissioner. So I'm really glad to hear that. I'm curious, and maybe this is going to be an offline discussion, about any other outside-the-box solutions that you might have to getting us away from just putting people in hotel rooms. I mean, maybe the county builds a affordable housing building, like somewhere.
There's so many rules and regulations that the cost can be just astronomical. Open Door, prior to this year, never took women, so that was always an issue for us.
Right, we have lots of women and children who need
Right.
housing, and we put them in hotels.
With those changes, after we met a few times this year, we decided it would be a better way to go. They provide a lot of other services, wraparound services, and casework with people who might stay there as well. Another thing that might affect this budget is there's new regulations with domestic violence programs. A person who is coming in for domestic violence services no longer has to fill out an application. They just have to come in and present as DV, and we have to pay for that somehow, and that money will most likely be coming out of this area as well, which could be a big cost because there obviously wouldn't be reimbursement there. The state is working on something in regards to maybe fixing that at some point, but it's definitely not going to be done anytime soon. So it's...
Do we have other housing options for people who are coming in with DV, other than hotels?
For DV.
Yeah, we do.
We do,
Yeah.
okay.
We contract with cafeterias.
Yeah, and they have safe houses.
For housing, okay.
And many of those individuals are...
Oh, yeah.
Go ahead, Superintendent.
Are placed elsewhere, but Warren County incurs the cost of a family within a 50-mile radius. possibly being housed in Schenectady County to transport any children,
Back to
school-aged
school?
children, to and from school.
Why
So
would
if
you-
you're driving down the Northway and you see a minivan with from Glens Falls or Queensbury School District in Schenectady, a good chance that could be for that family
Wow.
to and from every day for school. And if they're a BOCES student, it's a whole different, formula. But and you might see one kid in a minivan
Yeah.
traveling down to Troy each day, and that, ka-ching adds up.
Right, might be more cost-effective to build something here eventually.
Well, I certainly would agree with you. We definitely need low-income housing here. We need more affordable housing. It's one of the issues that we see all the time. The other thing is that it's become almost as difficult to get an apartment now, if not more so, than to buy a house with the background checks and the credit checks and the reference checks. So it's difficult for some people if they don't, if they have a couple blips on their credit, they can't even rent a place. So it's difficult. And a lot of places are charging 3 months rent up front. First month's rent, last month's
Can't do that
rent,
anymore.
and security deposit.
Wow.
Yeah, the new regs came in saying you can't charge more than 1 month, I think.
Okay,
1
so they would
month.
have to come up with, say the average rent around here for, say, a 2 or 3 bedroom apartment is pretty expensive. It's definitely going to be at least $1,000, so that would be a couple $1,000. And if they have any other problems with, say, National Grid and such, that becomes another issue. So it is, we need low-income housing, and hopefully there's a couple projects that I'm aware of. Some of these will go through.
Okay, Chairman Conover.
Thank you. I just want to make sure I'm understanding your financial plan correctly. You're projecting a decrease over 2019 budgeted revenue on track. Revenue going from 16.5 to 16, is that correct?
Correct.
Now, that $500,000, $500,000 difference, you're translating that into, what I can see is, at least in part, you're suggesting that your operating expenses will be, let's say, $300,000 less year-over-year. Is that correct? Feel good about that? And you see where I'm going?
I do.
I want to keep it real here. In other words, that we're showing a fairly significant decline in revenue for whatever reason.
I mean,
But it's being addressed within the financial plan 2 ways. You're projecting an increase, right? But you're also showing a decrease on the expense side, and I just want to make sure that that doesn't come back on us.
Well, we're seeing low numbers right now in foster care, and currently, the way the court is going, a lot of our kids are at home rather than in foster care.
So you have numbers behind that. It's not wishful thinking.
Yeah,
is what I'm saying.
I don't.
I guess let's put it right out
Yeah,
there. We're not.
if I sent everything that I bring to budget with me, it would be double. But I have all the, for one, I always do how you look at it, because it usually is
Right.
and typically foster care has been lower every single year. So I feel very comfortable lowering that on 6109, along with the fact that we do everything that we can to get them to fall under 40, because the reimbursement is so much higher than in the 6109, and our foster care program is doing a great job with that.
If you're comfortable with it, I'm certainly comfortable with it. I just had it. Thank you.
Thank you, Mr. Chairman. Supervisor Driscoll.
Thank you, Mr. Chairman. Chris, similar to, I guess, the sheriff's department, you're mandated to have certain positions at all times.
Exactly.
And if, to reduce a position is a long and burdensome process. It can be done, but whether a lot of people or fewer people are coming through the turnstiles, you still have to maintain those positions and reflect that in your budget. Is that correct? Okay, yeah.
This budget, we did ask for a few changes, bringing back the training coordinator that we did away with
Okay.
several years ago, and we're finding the need is just so great
Sure.
that we're bringing that back. And we're making a few other changes, but mostly what we did was trade-offs. You know,
Okay.
we'll give you this, you give us that. You know, just trading, like, one is a senior position, we've asked for a principal position, just a higher level, so that there wouldn't be a huge difference in our budget for salaries. But hopefully it'll meet the needs of the department much better.
Thank you, Julie. As usual, you have a great handle on the nuts and the bolts and what makes the locomotive move down the track, so thank you.
Yeah, she does a great job with a very complex budget, a lot of programs and a lot of funding streams, so thank you for recognizing us.
Thank you. Thank you. Good. Anything else, Julie, or?
The other thing, we did ask for an increase in overtime, that our overtime budget has not increased in over 5 years. And it just, I do the overtime budget every month,
Yeah.
comparison, and there's no way we could maintain the same levels we did 5 years ago. It's just with wage increases alone, it would be more than that. So that was one of the changes to this budget. And then the only other thing I wanted to mention for current is our BIT claiming system has been down for over a month. What's going to happen is that's how we get our revenue. So over the next couple of months, I've talked to the treasurer's office as soon as I was made aware, because initially we got emails that it'd be up and running in a few days. So, it's gotten to the point where now they're saying they're working on it, but they don't know when it will be fixed. So I just want it out there that over the next few months, our revenue is going to look low, but it will come, it will probably end up on our anticipated revenue for next year. It will apply to 2019. Rob is very aware of that. I will be working very close with the treasurer.
Thank you for the info. Again, a budget resolution is not requested on this issue. Did you have a question, Supervisor Bremer?
Yeah, I have a few questions. I'm going to start with that second one, though. Is that just an internal system?
It is the state system.
That's a state.
So I'm like freaking out. We're going to look like the hospital, where they had a billing problem and they don't ever get the money back. Or Westmount, when we lost all of that revenue because we did not file the claims fast enough.
This is statewide. This is
all
This is every county.
Every
Okay,
I
okay.
have every confidence they are going to put it up and running, and I thought it would be by now. That's why, I wasn't too concerned, but the last email I got was just maybe Thursday. So I am concerned. I thought the email would say it's running now, and it just said they're still working on it. So I
Okay.
just wanted to get that out there so that next month, if we
Mhm.
look at the revenue piece of it, I don't want anybody shocked.
Mm-hmm.
Yeah,
Okay.
the funding is there, it's just the system is an electronic claiming system, so
Yeah.
each county is having the same issue.
Okay.
So it's just going to be delayed.
I can just see the state, though, saying, oh, you didn't get your claim in fast enough. You don't get any of that money.
No.
Yeah, I don't think that will happen in this case.
Okay, my other question is on the overtime. Where is that coming from? Where,
The overtime is in our administration budget, and we're reimbursed about 76%. The overtime budget that we've had for the last 5 years has been $26,000, and we've gone over that consistently every year, and that's why for this year I finally asked you.
where's the underlying reason?
Oh, it's CPS on calls
Yeah.
mostly,
And a lot of it is
Training.
training too, turnover. When new employees come on board, we have to send them to Albany for training, so they incur overtime for those several weeks, depending on the position. It could be up to 2 months that they're traveling down to Albany. So they will get not a lot of overtime, but it adds up, obviously, if you have a number of these positions that need to be filled, if people need to be trained according to state regs. So they go to, and now it's Rensselaer, so it's actually a little bit higher in Currents as far as the overall time, because it's about a half an hour further at least drive from here to the Rensselaer State Training Center. It used to be down on Wolf Road. So it's, you've got to go to Albany, and then you've got to go across the bridge. So it actually, takes more time to drive. And we usually do a study based on, is it going to be more expensive to have them stay in a hotel there, or just to pay the overtime? And usually it balances out about, most people just decide they'd rather not stay down there. They usually have children and families, so driving to Rensselaer through the training process is not something that really they're willing to stay
It goes
overnight.
on for weeks?
Yes, for a
And
week.
there's no such thing as the state coming here to give us training?
Well, this is an interesting thing that we are actually quite lucky in Warren County that we are close to the training center. The state used to have training regions throughout the state. So if we were out in Buffalo, we would have to send people here from Buffalo. So imagine what kind of an issue this is creating. They used to have training centers located throughout the state for the various regions. Now there's one training center. And I understand what you're saying. It is, it's expensive. There is some reimbursement, though, through the process, but it does affect our budget. Fortunately for us, we're close to Albany, so any of this stuff is, we're in the region. Our area actually didn't change, but anybody else, if you're coming from the northern part of the state or the western part of the state or from downstate, it's a problem. It's a lot of money, and it's a huge issue for all counties. Fortunately for us, we're close by, relatively close by.
Thank you.
I know from experience that Wolf Road is, I think, 43 miles from, so you don't fall into that 50-mile category where they'll reimburse you for the overnight. I've had to, in the past, commute or have to come out of our budget. So, I mean, it is good that we're closer to Albany.
Yeah, we're lucky in that regard, actually.
Supervisor.
Quick question with regard to the system being down. Are claims backing up as far as data entry? Will that have to be, when they come up, all right guys, you got to spend the next 2 weekends entering all this stuff?
No, most of the data entry comes right down with the cleaning system.
Okay.
And then all we have to do is we go in, there may be a few manual entries that we have to make, and then after that I just approve them and they're electronically submitted.
Okay.
I'm anticipating the same day. The day they're running, we're going to have our claims done.
Thanks.
Great, thank you. Okay, again, Chris and Julie, thank you very much, I appreciate it, okay? Countryside, Ms. McBride, Amy.
Good morning, everyone. My budget.
Okay, we do not need a resolution to approve it. If you want to talk about it, you're certainly welcome to.
Pretty straightforward. Really haven't try to keep things down.
Any discussion on the part of members? Supervisor Lowe.
Yes, thank you, Mr. Chairman. I see the census has gone down a few people for this month. Extra discharges, is that people passing away or are they
Yes,
leaving?
actually, I've had 3 deaths in the last month.
Everything is going well there? You're getting
It
the
is.
equipment, everything
It's
is... You're
the
getting what you need to do
population.
your job?
Yes, it's the population that we're dealing with. We're
dealing with a very fragile clientele, and a lady that turned 101 last week. So unfortunately, that's her. But saw that the census was down, but I couldn't show you that I admitted 2 people. So the census is actually off more of the numbers I used to. And I'm admitting tomorrow, and I have 2 that are being rejected. So I could fill Countryside and Dalton easily, but the people that I'm getting the referrals for are either too medically complicated or the mental health services that we're talking about. They affect us, making sure that we can that we need for our population, and we can't be impacted for the state. So I'm pretty careful with who we admit. So I mean, if you see the numbers are down now, it's not that I'm not following up with every referral. It's just not the right referral.
Thank you, Amy. Yes, Supervisor Loeb.
The other part of the question, you've got a very successful facility, but a lot of different moving parts. Are you getting everything that you would like to see to optimize the service to our working residents?
I think we're working on that. I think that not everything happens overnight, and that, different steps that we need to do. But yes, we're getting work.
Okay. Don't sell yourself short. Don't go to bed at night saying, God, I wish I had asked for this.
Oh, no, I will ask.
Good.
But
Thank
I
you.
would-
Thank you. Go ahead.
Just more budget questions. The only thing that I have that I would like to do is to request the extension of Resolution 156 of 2019, those 7 members this year. The reason being is that's a key position. That is what is going to make sure that we get all of the needs, resident services met. And I don't, to make sure she's trained completely so she can train the next person. Is why I would
Good. We have a motion, Supervisor Loeb, second by Supervisor Sokol. Any further discussion? All those in favor?
Aye.
Aye. Very good. Thank you, Amy. Appreciate that. Any
The list solid. Sending the rest of the board to do
Thank you.
snap numbers sometime this week. I appreciate your comments. Yeah. Thanks.
We'll go to first round.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Yeah, thank you. Hey, getting there.
He was jogging.
Mr.
and he
McGowan?
tore his calf. What's that?
Seat
He was
is getting-
jogging and he tore his calf.
I'm going to sit here
Oh,
and...
yeah.
Oh, this is-
Good morning, ladies.
How are you?
Morning.
Morning. Okay, thank you. No, that was mine. Wow. We're getting through it. You're getting there. I think I can get this to Ryan.
Well, thank you very much, ladies. Without a doubt, the visiting nurses are my favorite group of county employees. They are always so highly organized and have had some firsthand experience with the excellent quality of your nurses, and you're a credit to Warren County. You do a great job. Janelle?
All right, we have one resolution request for today. It's to authorize a contract with a certified coding and OASIS vendor, which will be utilized by our home care agency to improve capacity for coding, ensure documentation integrity, and decrease the process for time and billing. That's attachment number 6. Revenues depend on accurate coding and documentation due to the illness and recent resignation, and in preparation of our patient-driven goal management implementation, which is anticipated in January. Coding services are desperately needed to ensure documentation and compliance and to decrease the billing process time. The vendor selection is in process but anticipated to be done prior to the October Board of Supervisors meeting.
Motion by Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? Do you have a question, Supervisor Bremer?
I'm sorry, guys. Not really, though. Where's the funding for this coming from?
Right now, this is coming from our salary and full-time savings line.
Yeah.
Later, you'll see I moved something to
Okay.
get to the end in there. I'm moving some money to just, for this year, and it is budgeted for next year. So these are our budget.
Okay. Did we get the motion? Can I, all those in favor of the request for certified coding vendor proposal?
Aye.
Aye. Supervisor McGowan? Okay. Approved.
All right,
Go on. Go ahead, Janelle,
the
sorry.
rest is for information, discussion, for review. In the interest of time, I'm going to let Tom take it away for the report of expenditures, the comparison report, and we also have a transfer request.
Okay, attachment number 1 are our financials as of September 16th. It was for revenues up till July. We just closed August Friday, so I'll be getting those numbers all together today to give the treasurer. Below is our salary summary again, to note that we're year-to-date from last year $11,000 under, and also to note that we're 57.65% of total salaries of the budget now, and we were at this time last year 67.76%. So overall, we're doing very well there. Attachment number 2 is our summary. Again, just our salaries, our contractuals, again, are related to timing of invoices. The preschool and intervention programs are comparable. It's our child right now that are, we have some therapists and aides expenses that still have to be input. Our revenues are, at this point, actually above last year at this time, and overall for the whole agency. The last one is our attachment number 10, which is what I was just discussing with Supervisor Bremer. That is us again asking for to get funds in. We did budget for the outsourcing that we're looking at. We feel we need to start that now. We've already looked at one agency. I know we've got to look at a couple others to get a close combo, but I am figuring out, we're hoping for November and December. Hopefully we'll be starting by November 1st. I'd like to move $13,000 out of our full-time salary down into our contract expense to pay for these services. And that's just for the 2 months, and it is budgeted in 2020.
Thank you, Tom. We are going to need a motion to that effect. Supervisor McGowan, seconded by Supervisor Sokol. Any further discussion? All those in favor?
Aye.
Status of referrals.
Okay, for the status of referrals, if you remember at our last month, there was some discussion on our visits and what does the referral number mean. And so we went back and we looked at our numbers. And if you notice at the bottom of attachment 3, we added a new section that gives you the revisits for our skilled nursing, our physical therapy, OT, speech, etc. So in addition to the referrals that we get every month, you'll see that we are also doing around 1,300 visits as well. So we brought that back to you. Also
Supervisor Bremer?
attached, we have...
Did you have a question, Supervisor
Oh,
Bremer?
I'm
Go
sorry.
ahead.
Yeah. This is great. I appreciate seeing that breakdown of the visits. Is the number of referrals, is that still brand new referrals?
Yes.
Of people? So we have that number plus the 1320. Okay, thanks. Yeah. That was definitely not reflecting the amount of visits that we're doing. The number from before, yeah.
Supervisor Loeb?
Yes, although you haven't included the data, 1,320 visits for July, how does that number, do you think, compare to the previous month's visits?
I would say they're probably
Pretty right on.
Thank you.
All right, also attached is our emergency preparedness activity sheet and the rabies report for your review. And for informational items, you'll recall last month we requested for one of our nurses to take 2 coding-related courses. So we thought it best to also add an administrative team person, at least gearing up into going into outsourcing the coding so that we're better prepared to work with this agency and understand the language and be all in line for going into January with the PDGM. So you'll see that we've asked for 2 courses to be taken by our supervising public health nurse, Jody Brine. From a staffing update, home care has 1 nurse that's out on extended leave and 2 nurses with an intermittent leave. We still have 2 open positions in addition to a per diem nursing opportunity. And with that, no questions, we'll turn it over to Ton for the budget summary, which is attachment 9.
Mr. Chairman?
Yes, go ahead.
Do we need
Loeb.
any authorization for the course?
No.
Thank you.
That's already in the course budget, I assume.
Yes. Don?
Okay, so attachment 9 is a long paper. I have to print on that way so at least you can read it. So I printed on 8.5 and build it big numbers. This is a summary of what we've presented for budget for 2020. Just to let you know that all the yellow are mandated expenses. Those are ones that we have no real reason. We have to just do what we have to do. That's our preventive program, which is what Janelle is the director. Her salary is part of that. The disease program and our preschool and early intervention program. If you notice, they total $4.4 million of our total expenses. It's 40.32%, just to give you an idea of how much of our budget is mandated. One thing I wanted to note, the orange column that I have there, those are where we usually try to put our estimated salary and fringe related to any kind of reductions we can help with the budget. We did do a few little changes with our home care, our child, for $4,886, but the bigger one is in our disease program. We had budgeted last year a supervisor position, and Pat took over as assistant director. We wanted to keep that supervisor position, but now that we're talking about outsourcing and using some funds, we felt we needed to, at this point, we have a full position, we're going to use those funds to help pay for that. So that's the total of all our salaries and fringe of $96,000. So we're trying to be creative, and hopefully that'll help pay for that. Again, we don't know outsourcing is new to us, but once we get going, get that, what we budgeted, we hope will be. We're not expecting to do 100% outsourcing, but we did have to find the funds. We cannot cut any more nursing positions. So this one was an empty. We always try to, if anything, a position that is vacant, and at this point, that's what we're going to do that in budget.
Thank you.
To know, our WIC program and our bioterrorism programs are both fully funded, so they are a zero impact. It is also to note that our bioterrorism grant went down $2,000, I believe it was. It was $52,096. Now they've reduced it again down to $49,625. So that is what we budgeted in 2020. It did start July 1st. Their grant goes July to June, but we figure it's going to stay the same, if not go, stay moved down more. So the summary, kind of what I show down here, is our preschool and early intervention program. Again, those are mandated. Between the 2 of them, they're 67.24% of our total budget impact. So they are a huge impact to our bottom line, and again, they're mandated. Regarding our outsourcing, we had in budget, we budgeted about $50,000 to use for that. And then also one thing we came up with is our therapists for the home care have not had an increase in a long time, and they're expected to do some more stuff with the home care, and specifically Oasis is called and everything. And so we're asking for an increase for them, and I'm expecting that based on our numbers we've looked at. In our budget, we put in an extra $22,000 for those things. Those again are billable visits, but it's paperwork that needs to be done to be a fully billable visit.
And to clarify, that's just for the long-term, or home care therapist. The early intervention therapist and the preschool therapist are rates associated with the state, and we're working on the therapist seeing our home care patients.
And another thing that one thing that came up was our transportation for our early intervention and preschool programs. That was a big hit with Durham, who's the bus company. They started September 1st. We had to get into a new contract. We put it out to bid. They were the only ones who bid. We have used them for quite a few years now. The preschool programs only went up like $4 per visit, or per child, so that was a lot. Our early intervention is the one that got a bigger hit. It went from $53 up to $88 a child per day, but they only go like 2 days a week, and they go for 2 hours, as opposed to almost an all-day with preschool. So it seems like, I really thought it was going to be a bigger impact, but it wasn't as big as an impact as we thought. The overall net effect that I budgeted for is it's going to be about an $18,000 impact for early interventions for our bottom line. These preschool kids, 20 to 25 kids, that's all we're talking, as opposed to 75, or early intervention kids, I'm sorry. There's about 20, 25 kids right now that do that. The preschool is more like 75, so triple that, so I'm glad it's not the preschool. But they're saying that if they have a driver come to drop someone off, they can't send their driver or do anything with them because you're only there for 2 hours. So it is more expensive for them to have a driver.
And we're working with staff to educate on what kind of resources the family has for transportation. Maybe we can utilize what they have, supplement with that, versus going straight to the top.
And the other thing is that when we analyzed it, about half of these kids are Medicaid kids. Medicaid, I can bill the transportation through our DSS. I don't know why it's always done that way. That's how it gets billed. We send them the information, they bill the state, and that's paid at 100%. So when we looked at the revenue impact of that, again, it wasn't as bad as I thought it was going to be, knowing that half of these kids, they continue that their Medicaid will get better. We only get 49% back from the state on any other, but the Medicaid is 100%. So we took all that into factor when we did our budget. Another thing I just wanted to note was our retiree health insurance, which is always part of our budget, is $248,554, which is 10.5% of the total impact we're expecting. The home care is, of course, our biggest program when it comes to retirees, and I just wanted to say that the retiree expense on them is 80.92% of the total impact. So it's a big chunk of the home care. Obviously, their bottom line would be a lot better if that wasn't there. It's still going to be part of the county, but I'm just giving you an idea of what's a large impact to the thing, to the bottom line. I guess that's pretty much a summary of what we did. Like I said, we tried to look at where we had to have increases. I just want to look at my notes. Oh, and yes, DSRIP. DSRIP was money we got from AHI that would help us. It helped us get laptops, helped us get telemonitors. It's if you show improvements with your patients, you get this phones, you apply for it. We were able to get that. That is not budgeted. So if that comes in again, which we're crossing our fingers it will, that can only help our bottom line, because we'll get whatever we need with that money. The other thing that was new this year, just started in December actually, was our, it's called the CARE grant. I'm not exactly sure what that stands for, but it's through DSS, and we were getting those funds, and maybe Janelle, you can explain a little bit what that is. Again, that's not budgeted. It was $50,000 this year, and we did amend the budget for that, but those funds are not budgeted, but again, we're crossing our fingers that we might get something from that again this year to offset our expense.
What the CARE grant is basically a collaboration with social services for their CPS cases that are involved with some type of opioid or drug addiction type of use. And it's where they basically are asking us to put aside a nurse to be there for consultation and as a resource for their staff. We actually do a joint visit with the CPS worker at that first visit. We help come up with a plan of safe care that then is a collaborative effect for all the people that touch that family's lives, all the pediatricians, the obstetricians, things like that. So it's been very successful. Started off slow, but now we're getting a lot of referrals. But it is a nice collaborative event, and hopefully multidisciplinary approach that's going to improve the success of the family in their rehab.
So that
Good.
funds that, like I said, it's $50,000 this year, and then the end of November. We don't know what it will be next year. We don't know if they'll still take the grant. We don't know if they're going to share the grant with others. But if that comes again, that'll be additional revenue that will offset our expenses on there. So that's good.
But thank you. Chairman Calhoun.
I brought this up at the last meeting relative to the referrals and the referral agencies. And I'm bringing it up again because I don't want any of you to be uneasy with this topic or should there be an issue. I'm not suggesting that should there be an issue. You should not be uneasy with bringing that to the committee. That is a balance of character of the type of referrals that we might be getting as opposed to the other providers. And I guess what I'm saying to you is, should there, you see your head shaking, yes. All I'm saying to you generally is, should there be an issue in that regard, or should you have a concern in that regard, that I would strongly recommend that you bring that to the chairwoman of the committee, and that we make the appropriate contacts with whatever entities require state agencies, etc. That so it's not just a question of the referrals; it's also a question of the character of the referrals. And everyone needs to be providing the same lift. That's not happening. I'm not saying that. What I'm saying is that should not be a topic. You should be uneasy about advancing the appropriate channels that the county administrator and the chair of.
Thank you.
Thank you, Mr. Chairman. The, one topic that came up this morning, there was a fairly heavy amount of discussion, is mental health services, the changes in terms of responsibility with Glen Swallows Hospital, and although it hasn't been verbalized, I think, but I'm just thinking here, the close intersection of mental health services between visiting nurses, between the general mental health services in the county, but again, Glen Swallows Hospital seeming to move the basketball a little bit, and so the trying to ensure a transparent and system where the pass-off is indeed effective, efficient, but most importantly addresses people that have issues. So, but again, nurses, you're right in the middle of this story to a great extent. So, yes, Supervisor.
Thank you, Mr. Chairman. A member of Health Services was named in the Post-Star editorial over the weekend.
Oh.
And like social services, there's a lot of moving parts to the health services budget, health services agency, and I recently attended a program on vaping up at Lake George Elementary School. So there's a lot of things going on in that department, a lot of lines and different types of services, all health related, but yeah, they were mentioned in the article or the editorial on mental health.
Thank you, Ben. Mr. Chairman.
Yeah, just one other element, and also I think that your review, which I know it does, should also focus on the geographic representation of the clients, because, for example, perhaps it could cost more expense to deliver that service to a remote or rural area than it does to. So it's not only the programmatic breakdown, but also the geographic breakdown. Very much rely on that, because in the end, that's important that there be balance.
Yeah.
Thank you. Mr. Loeb.
Yes, thank you, Mr. Chairman. Tomorrow, we're going to do the DPW budget, a large budget. I don't think anything's mandated in that budget. We provide those services. Every year, we say, well, we can afford this much, and we want to pay this many miles of roads. We just did the social services budget. There were a lot of mandated items there. We see there are a lot of mandated items here, and that seems to be a popular scapegoat for elected officials. I'm wondering if they weren't mandated, well, what services we would like to cut. Or maybe we should stop using that as a scapegoat. That's my lament.
Okay, well, interesting observation, you know? Okay. Thank you. Are we, I hope we're done. Can we get a motion to adjourn?
Well done, ladies. Thank you.
Thank you.
Supervisor Sokol, second by Supervisor Driscoll. We are adjourned.
Good job, Peter.
Yeah.